Who will be the first three? First three presenter, who will be?
Manith.
Manith first. Yeah, and then? Okay, I will ask another two students to comment on each work of the presenter. On each presentation, there will be two students officially assigned to comment, and the other students also can comment, can ask questions, everything, but at least two.
Good afternoon, everybody. Good afternoon, Ajahn. And today I'm going to do the presentation related to local institution, according to my experience working as an officer at my department in Cambodia. Before I enter into my presentation, I would like to start with revision related to local institution that we have learned. Do you remember how many categories of local institution? Ian, Mr. Tan, Thurn. What are the categories of local institution? Here. Why? Because we have learned already about category of local institution. What are they? We have 6, like local administration, local governor, local membership, LMO, organization, cooperatives, and then private business and what's that? LSO, local services organization, right? Okay. We have 6 categories of local institution. I think you have learned already and maybe you should review more. If you don't know, don't remember, how can you do the presentation? So among them, I choose one is local administration LA to do the presentation here. Local administration, as you know, is agents we working moderate apart and appoint from the top. We call ministry or institution from the higher area of working. For example, they located mostly next to the government, a separate agency to separated area. So the local administration is their branches working separated from those the ministry of department, ministry of institution in order to separate work and control in one area or one specific location. Like here, I choose local administration because my office is under ministry and it's separated working as the middle agency, cooperative local area and the government. So it's about Kampong Speu Provincial Health Department. I call that my department KS PhD. PhD is Provincial Health Department. Here's the content. Like we know, we will study about background, like address establishment years, branches, structures, staff, objectives, main functions, accomplishment, and problem and solution. And maybe I need your comment inside because my organization, or no matter what organization or institution, may have differences and in we call problems and solution. Maybe you have better idea for that, and we have not only achievement but we also have problems that we need to share and under discussion. The background. Among 25 provinces, Kampong Speu province is located at the west of Cambodia, in the southeast of Tulesap River here, Tulesap River here, and then it's located here, and Khon Kaen is here. It's about 48 kilometers along National Road number 4, and then travel to the west. You can reach that province. In this province have 4 FX districts. Normally we call district, but nowadays the local institution of the government they provide you that for each province have town, so that we reform from one district to be the main town of one province, and then we have act among of this separation like this, and this is the main district. Chumamo district is the main and located in middle of the province. That's why we put into town. And Kampong Speu province have a population about 112,000 people. So my department is located in Chumamo town in middle of the province along National Road number 4. Here is my department, Kampong Speu Province PhD Provincial Health Department, located in about 2 acres of land. You can offer main building consists of 2 floors and have 11 office room and 2 big conference rooms and 1 kitchen. And its establishment in 1997. Just only the land with only 2 buildings, small building. And then in 2005, the government supported fund. The government have one project called not project strategy called development goal strategy for education and health. So that's why they provide more money for education and health. During that time, a lot of building and also school were built, so that we can get this building just by 2005. And located in the same area, we have a lot of offices working under the department. We are like building of HIV, operational office, we call OD. Operational office in Kampong Speu province has 3, I will tell you next. And babies and mother office, vitamin and preventive medicine, and vaccine office, hemogenic, fever, malaria fever, accommodation, 2 parking zone and 1 warehouse. This is just background of my office. So branches, the main branches of PhD has 3 important operational districts. Because we have 8 districts, so we divided on only 3 districts that have the operation, the main operation, that is located in the whole province with 50 health centers. And it is, you see, this is the yellow one, and the yellow. 3 of them are operational district, we call OD. What are they doing? They're important because under separation of department, they work and responsible for their area or 2 or 3 districts around nearby. And here, this is my PhD, I mean the main department, and this is the operational district OD, and there's also, and the logo of plus with blue and white. These are the health centers. So under the department have operational office, OD, health center, see, health center, see 3 referral hospital located with 3 OD, and some health posts. Some health posts. Health post is just a post for check for giving information of health, but it's not the main area that people can go to cure or get treatment. We provide some training, consultant. They are serious, they have diarrhea, they cannot go to cure that. But they provide you some material or transportation to bring you to the referral hospital. This is structure of my department. Start from director, and then we have 3 deputy directors. Among the 3 deputy directors, we have 1 director hold 4 important office. 1, 2, 3, 4. And 2 more directors hold different things. 1 deputy director hold for 3 OD, and then another 1 hold for 5 activities. Beside our department, our work, we have another 5 main activities that I will show you next. Here, what we have done, what we have in brief of our structure. 4 important offices are bureau, in Cambodia we call bureau, or because we used to have under colonization of France, or you call office. Bureau of Technical Affairs, 1, Bureau of Administration and Personnel, Bureau of Finance and Accountant, and Bureau of Drug, Food, Medical Equipment and Cosmetics. So 1 deputy director responsible for this. Another deputy director responsible for 5 main activities that under his control is activities for babies and mother, activity for vitamin and preventive medicine and vaccine, activity for hemorrhagic fever. You know this one? This one cause of mosquito, but this is how do we call the mosquito, local mosquito. We have 2 kinds of mosquito. One is mosquito that bite you at noon, and another one at night. This one at night, and this one at sorry, this one at night, and this one at noon.
At noon.
The mosquito with bite and like.
Oh, the hemorrhagic, is it a dengue? Dengue, is it? It's mostly if you stay and live with this one is normally for us that will get we stay here. They use the technical word. Hemorrhagic.
Yeah, and for the malaria, for those who stay in the forest or something like this, but you got bitten by the mosquito, but at night.
Do you have dengue? You know dengue?
Dengue. I'm sorry, I'm not familiar. Dengue.
You know Yung Lai, you know Yung Lai. Yung Lai. Yung Lai is Thai word, you know Thai, right?
Yung is mosquito.
Mosquito, Yung Lai. There's a black and white.
Yes, that black and white. Sure.
I think that's why I say that the one should be dengue.
Yes. So that's why. That's why I say like in Cambodia we call tiger mosquito.
Call what?
Tiger mosquito.
Oh.
It means that the mosquito that
Tiger mosquito.
have black and white.
Right.
Yes.
Right. At the end, right?
Yes.
Black and white at the end.
Yeah, like this. So that's why there is a ball to tiger. And next is 4 main branches that I say that another deputy director will be responsible for OD, hospital, referral hospital, health center, and health post. Okay, one is Bureau of Office and Technical Affairs. Under that they have separation and structure the same like what I said, but they have under Bureau of under deputy director we have office, and in each office have chief of bureau, chief of office. Like chief of office, under chief of office we have deputy chief of small work separation under that, like working responsible for health, planning, training, and supervision. And this is my office. I'm working under this, under deputy chief of planning. And
For health related to the work, mostly technical work is about doctors and other things related to health care protection. And for planning, IT technician, AOP is the main project of we call health development strategy and report to the donor. And training, we have training and facilitator work in internal and external for the local people. And we have supervision, those who have the main action inside the department is them. Because if we have done something wrong, they go and check and report to ministry, not us. So they have high power. They have only a few people, but they have a very high power from the ministry to follow, because put an eye on us. Even director has to listen to them sometimes. They go and follow. If we go to train people in local area, we set them out like this and we do a separation 3 days, but we do only 2 days and a half, and they will call us back a few days later to answer our question in meeting. Why we do only 2.5 days? So you have to respond to them very fast. And next is Chief of Bureau of Administration and Personnel. We have HR, we have report, meeting, facilitator, we have assess, and we have transportation, important transportation, we have ambulance and other things that need to carry the stuff to the rural area. Maybe, sometimes we set up the meeting with local people in the morning. They work in the morning, they go to the field in the morning, they said they're free in the afternoon. So we go to meet them and vet them and go back at 12 at midnight sometimes. We spend a very long way to go to the rural area and very difficult. So transportation is very important. Under that, they have one power from ministry because the department just control it, but the power of management called facilitate of those transportation have to have a very strong report. And some, I don't know, but with other countries, they provide authority for us to control those transportation. But whenever we use that, we have limited right for using them. Limited rights. That's why sometimes even me, I never use or request that because it's too complicated. I and my office and my boss ran private thing use outside. And next is Bureau of Accounting. They have Chief of Finance, Chief of Accountants, and Chief of ASP or AOP. This one important because all of those donors go through our department through this, and they control very important money and project. But all of them never see money or never hold the money. They know only document, and the money is in the bank. And whenever we process, the one who spend money is my office. They never can spend, but they just know that this year they gave us, for example, tens of $100,000 for us the project the whole year. So they know, and they separate and see the meeting with us and something like this. But the money that's spent actually with my office. And another bureau is Bureau of Drugs, Food, Medical Equipment, and Cosmetics. We have like the one is for living is related to drug. Their function is they store and check the drug availability in hospital and providing drug and also other equipment. And this one is related to food. Food important because nowadays WHO, WHO, World Health Organization, they support us with money, but focus on we call agricultural product, organic product for the local people. In the past, we used to buy things from market to give them and not give to offer the food for them every day, just to show them that this kind of food is important for especially mother and baby. And that we do every month, that's activity. And local people now know how to cook, how to make, how to find. So the fund that provide is to buy the local, it seems like corporate, local product from those people, and they do fresh from that without chemical, and then again to serve the people in that area. So this link project, normally we have, just recently we have the project link with Ministry of Agriculture. That's the success, so that's why WHO still support farm, because it's in that one thing to help them and buy the local product with the market better to give them at least some earning for that. And people in local area closing just small thing but important for their living. They don't know, so we do training for them providing this. And then medical equipment and monitor evaluation. Okay, let's to start. In our department, we have 36 staff, and this is just only my main office, the 2-floor building I show you. But the other staff work separately, like in OD, each OD have 15 staff, and then each hospital have this more than at least 100, and now they update because this data is 2010. While I'm working, I know, but now they update more than that. And then health center have 250 because we have 50 health center and each health center have 5. The function of health center is important in 1 or 2 community next to each other. They put health center. Health center is a sub hospital. You can go make some treatment there. They have doctor, at least 1 doctor, and 3 or 4 nurses there. They work, and if you serious, they send you to the hospital with a lot of equipment. So finally, the staff in our department is 686. The objective of our department here are the objective. A lot more than that is about 3 pages. Objective and separated in different areas, but I summarize to make important objective for you. One is operate national policy to improve health and quality of life. This is the strategy of government and the World Health Organization. Provide as many health services nearby. First, we think that hospital is important, that people can go free of charge. But now it's more important if in community have health center or health post, they don't need to go to hospital. For example, I have problem with my headache and the doctor go and check whether what happened. Maybe I got headache, I heard. So they don't know how to buy medicine, they go to the market by themselves. So the doctor said just go and see them, they provide some medicine free, and also if they don't have, they give ordination for you before you go to the market to buy by yourself. And provide health care and training, prevent and protect the local people from any spread disease, for example H5N1. We have this kind of office and agents. And develop community health care and knowledge. We call one community, one health center, what I said at the moment. So the people need to travel as long as they go from the very far area to the town to get cure treatment, unless they are very serious. To maintain the health of victim and patient, because some people have no money and their patient they don't have, so they bring to the hospital, so they don't have money to the private one, to our hospital. We provide free service and they can stay there. But some disease we cannot cure, we cannot treat, so they need to find other modern facility that we said. However, we support them, we have project. If you cannot go, we find the suitable hospital for you, and we have some money, some package of money for you to go. And provide emergency service for treatment. In one province, we have like this, corporate with donor and any health care services. This is our objective that our department do, but the others more than that I think the other a lot, so that's why I summarize only important thing for you. And okay, here one main function beside objective we have main function like I show you. What I tell you is first thing is start with
caring health care to the people. So at least we have this is referral hospital, and we don't have more hospital because we need to spend more, and government allow only 3 in our province, and some province have only 1. So it needs a lot of facility and staff. That's why they can't have budget like this provide not enough. But at least they try to develop in one area have this kind of places for people to go and check. Every time people, every 6 months or 3 months, people have to drop, how do we call it, the work inside the body, something like this. So they don't know. But health center in one community, their staff promote and tell and remind. Sometimes they very busy doing work and they forget. So 3 months, don't forget, okay, nearby your house. So they go and get the medicine and they can check in some other thing. So that easy for people, even cannot do anything, but remind them to take care of their health, how health is important. And then another function is provide training, what I said. Here is training in the department. Normally our department is used 100% by many organizations in the province. And every week we have everyday training, different organizations that come. They suggest because related to health, and they call on people to work there, and we provide free area for them to do. We have 3 conference rooms. Some day I have to manage the operating and computer for them. 3 different rooms and 3 different organizations to work and get trained in this area. So that's why we think that related to health, preventing and training is important, and we provide for them to do that. Support and operate 5 important activities that I said at the moment. Here, people use, nowadays people think that they have money, they buy only the meal, the powder for, best powder I think, for their children. But we suggest even you have money, that's important for mother. So we do with health here, with organization and donor to support this study from now. First, they think that they have enough money, no need to give them anymore. So we show them, actually we call on the mother and to talk and say, can you cook the porridge for your baby? And then I can, they come up and cook here. This is how we show how the people participate in local activity with health improvement. So normally the staff make it, but now no, the staff facilitate and mother come and do it. And let's see that this is my children, and they show my kid. You see how healthy he is. So I cook the porridge for this. So it's very famous, and now most mothers try to understand that they have money, they buy a lot of powder and advertisement that for their baby, but they forget cheaper things around nearby, cook and easier and better health for their kid. And we have activity of providing how we call vitamin and other protection vaccine. Normally in modern country they don't care people, they have knowledge of that. But in Cambodia, local people they forget, they never care much about their children under 1 year need a lot of vaccine, 9 times vaccine, something like this. So we provide them every year. And now they start to recognize, no need to tell them. They know that next month I go injection for my baby. So they know and take their baby to get injection. And this is what I tell you about hemorrhagic and malaria that we have every year. But now we have last year we got the admiration from Swedish government about removing malaria fever because of using sleeping net, right? Sleeping net, okay, we use that, but people know that, okay, I stay inside that, no more mosquito to bite me, but they don't know how that mosquito will be
sleeping net can protect you, prevent you if you use the medicine that they provide and provide free. Some people say, oh no, I don't care, I just have it is enough. But now people know every 3 months they come and take to get that medicine free. Every health center we provide them free. And at HIV healthcare, normally I am the staff, I will work on it. But now no, the staff of HIV, they prevent and protect, show about training related to HIV and people who get HIV. There's only officer and NGO, but now no. Student, one agency. So every year, one student, every school allow the student to register as volunteer, and the student very happy to know and learn about that and separate share to their village and get learn. This is one student. I showed she got #1 from the governor, provincial governor, because she only herself she can give training and about HIV prevention to more than 10 villages nearby her village. She said, I have nothing, they give me nothing, but I happy to show what I get and learn. She saw like this in the province last year. That's why she get success and now she appointed to study in training outside, but she's still high school student. This is because we promote students to join. Students have better than officers, and students stay there longer than prevent them. And some research, we facilitate with health research. Every year we have a lot of researchers come to research about health center, health care. They support this area. People, if we don't ask and don't talk to them, we don't know what happened with their health. We said hospital is a place where people go to cure. If I'm not well, I go. But it doesn't mean that they are not well, they don't know themselves better or not, have fever or disease or not. So that we set up a group for facilitating research of disease, different diseases in local area. Most of them have a problem of using polluted water. Yeah, so that's why a lot of problems that need them to know whether you have, sometimes said, I have just diarrhea, just normally, but they don't know that if they have diarrhea more than 5 times a year, what happened to their health? It's related to, I don't know, I'm not a medical doctor, I'm not health officer, I'm just another biography, I'm not sure about the body, but it's connect from the stomach, it's like a string. Yeah. So they don't know what happened if they got diarrhea, just like normal like this. So we go and ask them, we know, oh, they get more than 5 times, or some people 10 times diarrhea without any reason for years. So that's problem. Let them go and get medicine, iron medicine like that. And here we facilitate the other doctor from outside to check and provide their facility like ice care, protect, prevention like this. And this is other function. Other function I can say in brief that related to construction and providing fund and donor to other community. Accomplishment. What we have done, like I said at the moment, malaria reduction, we get #1 level, national level. Kampong Speu province has 99% in 2000 of the people get malaria because we have living around the mountain. But till today we have only 5%. So 90% from 2000 to 2012 we get reduced up to 5%. And now we have how do we call the admiration as the verb WHO they provide to us, and also call our staff to present in Europe last year. And health infrastructure, completion and processing, and gender health promotion. Nowadays we have promoted not only gender like you, ladies and gentlemen, but now we promote a new training is about those who love the same sex. Ladies and ladies, men and men. And they go to share, and normally we don't know they love each other, but when we announce that we have training, they come a lot in our department and we know that they love each other. They need voice
protection and also new policy for prevention of health. So we get this new thing accomplished, and we have joint Red Cross participation. We have fight against H5N1 in 2008. Kampong Speu province is the serious area in the west, but serious because the disease spread from Vietnam to Takao province and to Kampong Speu province. Two provinces have disease, very high disease, but only our province that fight against them very fast, very quick like this. Because one reason that they make fun, we have not many population, that not many people die. This is, they said, fun, but it's not like that. Because when new disease comes, people feel afraid, and a lot of people come to check and health center for this information. And next is out of this vesting projects and other achievement national report. This is my office have done. My boss get success last year to the ministry, because normally we spend 100%, they give us, but we never spend up to that. So only my province that success 50%. It's not mean 100%. Donor provide us to spend 100%, but we spend only 50%. But my province, only one province among 25 get this. And the problem, we have problem like lack of referral hospital, health center, and health post, as I said. That's why our service not spread to them all local people. And we get complaint recently, 3 years already, about the patient that our hospital not good in morality to talk to the patient like this, because they said public hospital not doing something like this. So okay, we accept all their problem, and we projects we miss follow remain activity and remain fund. Normally I study project management, they heard only that people spend money more than they can do, more than money they provide. But for us, we cannot spend up to money they give. And staff demand support fund for current activity. Actually, the government provide not many salary. We depend on the donor, like my office. Donor provide money, that's why I can use money to go to rent transportation to the rural area to see those people. And another one is corruption. This is the main problem that our province just get recently when I come to study here. I don't know, I just heard the news that the construction in our province use a lot of money. That's where are the accomplishments, where are those buildings. That's why. And now they call on and they put mistake to each other. But I am just a very small staff. I don't know about that. And this is some solution I set up for my ministry, and they have done already, some already. Now they're going to change some stuff because of corruption. And I think that's all for me, and if you would like to join, you can share.
Yes. Thank you for
Sorry,
may I ask two commentators, Pinky and Hamseng, to be commentator for this presentation.
Yes.
You may comment or ask questions.
Question or answer? Question. Shoot answer. You can ask whatever you want.
For me, one thing I have noticed that as it is a part of Ministry of Health, and it itself is a department of health, so I think there are some activities missing functions, like related to some policies, because as far as I understand, department is somehow responsible to take care of the policies, and it might be different in the context of Cambodia, but in our country, under the ministry, there is a department which takes care of provincial offices, government offices, and they are very much responsible for monitoring, evaluation, policies, and decision makings, and forming new policies for better care or better services. So I think I miss to have this for the generation, or maybe they might not have these types of functions as well. So this is the first thing I have noticed, and I would like to learn about it. That is, what is the situation related to this my concern?
I'm not sure what you miss out.
Like I said, Department of Health should be responsible for like policies, for making laws, rules, for other like you said about other the provincial health posts or centers, something like that. So for me, I think Department of Health should have some functions related to policies, or maybe constitution, regulations, something like that.
Actually, department is working under ministry. Some decision making is just like to allow or to work on the operative, or we call it assigned policy already. For example, they set policy in a package, and we can only practice. And the director, even my boss, they can have have power in making decision, but level of decision is like our office to do 5 things. Now start 3 things first, and 2 will be later, and another 6 months. We can only this, but we cannot. Can we say that we make up and separate this activity to more than this, or to do this better than, or change this for this year? We cannot have this because they set up policy. But however, whenever we have problem, we set up for report and evaluation. Because when we have meeting, not our ministry, our meeting always join with public sector, NGO and public sector. They support us and sponsor us. So that this year we provide 5 activities, but sure they evaluate not good, and we have found a problem we would like to develop. We suggest our development, and not only our department. Each province do the same thing together in the same year, but they have different problems. So from time to time they allow to develop, so that if this year you just do it, next year okay, you may have this. So now they give extra activity without providing or appointing. For example, my office do only 5, follow them, but if you think that 2 may fail, you have 2 space free. So take that free activity that you think better to put in. So director and other deputy director come and discuss to set up 2 activities that better to make it. So normally you have to complete 5 activities per year. Just example, but not 5 for my office, more than 50 activities. So if you cannot complete that, and you see that 2 activities cannot complete, you can take out, and then you can report later, just make decision to take 2 more. They just provide some authority for us, but not much. And you see, because we are the agency that operate with local people, but not making decision. 1. And 2 is about setting up rule and regulation and other things else. And you see, we mostly work to provide with services and activity, but we have never set up any regulation or rule for that, even other activity, because we have never found that's important, or if we have so, that is not our obligation, we cannot do. Whatever we do is, like I said, is just follow up the activity that's set. We have planning like office. I plan next year, so if we plan and they accept already, so we have to do next year like this, follow all. And if you fail, report, and then come out to present why you fail. This is problem, and you have to defend it by yourself, by group. Okay, do I answer to your question? You can ask what is different, and you can share. Like rule regulation, sometimes we need to make even the office, but we have no voice, we have no rights, we have no power to do so.
So it sounds that this department is completely working as a service delivery. I mean, they are not working as like, they are not guiding any other like public sectors or other sub-provincial institutions, but they themselves are working as a service delivery because they depend upon the Ministry of Health and some international funders. So they have to spend the fund and they have to follow the rules and regulations formulated by the ministry and funders themselves.
What we can do is, what we want to do and accomplish every year is just to finish activity as much as we can. Because in our department, more than activity that we can do. And those activities has different type, various type, different action with local people. You know, a district thing is little but very big. And our staff have to separate and move from one week to another and change to another village. Because we have to move in and do like training. In the season of training is in the mid of each year, means 6 months we do training. So 3 months we cannot complete all and we separate group and not involved by our staff. If we do training, we have local governor, we have representative from donor and ministry. So many groups have to join together and follow and travel and sometimes sleep on the way and back because we have to do and complete that. And when we complete, we just don't want to complete the activity without feedback. We will go and check in another 6 months. That's why start from January, February and March, we do training. And then July, August, September, we have to check again what we have done with those people, they improve or not. This activity, this I just bring up one. And that's why we facilitate and we open for all organizations to join and cooperate it, and we work with them. But we have no any adaptation or establishment new, but we can propose as report and report. Yes, something like this. Okay, nothing.
Your organization is quite big.
Sure.
But you mentioned on maybe second or third slide, you have very important department for info about drug, food and medical equipment.
Yes.
In here, you just put for the medicine and for who has disease and get facility and training for HIV. But I want to know about the issue of heroin drug. It have any issue in your local, or have you have to give or prevention for drug?
Sorry, I don't get your question. Please ask again. Make it short.
You mentioned about you have department drug, food, medical equipment, but you already explained about HIV and heart disease, how you support, how you give training, and I want to know about more about its drug, heroin.
Oh, related to HIV only or?
Not HIV, heroin.
Department.
Drug.
Bureau of Drug, Food, Medical Equipment, like this one. And related to this, normally it's mostly working not with we call the last visitor, sorry, that's IT work. It means we work officer with officer and private sector. Because in one province does not mean that only public hospital. We have public, we have private pharmacy, private hospital, and we do covering about how or check how they use drug, like expiration or drug suitable or not, provide to patient. This one. 2, it's about people complaining about using drug and have problem. This is also come to this office because they check and why people have problem of using drug. So it means we mismanagement with those people who sell drug or provide drug outside. So we call on, and the office of supervision,
we'll call up for discussion and solution for better than and solve with them and take care with those people who have victims. Because recently, every year we have problem. Like last year, we have two problems. One is the mother died of the private sector, private hospital. Two is the use of wrong medicine. And the pharmacy, they said, oh, I got fever, I just go to private pharmacy and to get injection and serum, right, the word, to cure, and then I go and sleep, stay at home. Yes, but tomorrow he died. Because, and then they check that the serum to use for him is have we call infection with his fever. His fever is not with vitamin C to reduce the hotness. It's not because of the temperature. It's because of his disease related to the stomach and lung inside. So that's why he don't go to check with doctor. So that's why if you have problem with using drug, we cannot blame those victims. We call on this and this office responsible for that. One, that is two. Another one is related to providing drug. Drug means providing supporting drug to a center and hospital. Make sure the drug that better and change and develop every year. Some drug cannot use. Some drug have to remove and report to department and report to ministry that it's not work with this area. 3 districts need this kind of drug. Like malaria, we used to use some drug export from France, but now we don't use. It's even expensive. We use from Malaysia because malaria is better than and quality they check from laboratory. So it affects 2 districts that use that drug better. So them also do like this. And training of using drug every year, we never rarely conduct with normal people because we would like those people who know how to use drug and then train more and make sure you provide drug to people better, right way. Do I answer to you or you need more? No?
Yes.
You need more, right? What?
No.
Oh, okay.
I mean, answer is yes.
I think time is up. You have,
I'm sorry.
anyway, we
Presentation.
can have, few more short questions if you have from any other students.
You can ask. Because I'm sorry, that's big. Because each department, one department responsible for one province, big already. I cannot choose my office because my office has only 4 staff. And when I come study here, only 3 staff there. And what I work is only for planning and report, 2 functions only, and then finish.
Any other questions?
So if I talk only in office, only 5 slides. Okay.
Any other question from class?
No question, again. I want to know about in my country, in my province, for the pharmacy.
Yeah.
We can buy drugs without obligation of medical doctor. How about in your province?
Sure. We can buy. But when have problem, and then the people, and then the pharmacy and the people have responsible for themselves. First, a lot of complaints, Chan, because no, I buy medicine and then have problem. I'm sure at that private pharmacy and those not getting a doctoral degree or maybe fake doctoral, not registered by department. So what happened? We're not responsible. However, we still help them to bring them into emergency to capital city, not level of our hospital. Normally, if we have that emergency, the ministry said bring them to the main hospital in capital as fast as possible. They have a lot of equipment and doctor to shoot. And now we training them and spread information every day. Every year we call a day of knowing health care, a day of knowing how to protect your health, and a day to go with Department of Health. So we walk along the street and sound and loud like this. Want to alert people that you should know that how you prevent yourself even with private sector. But nowadays they learn. Even I sell medicine outside by myself with pharmacy and register. And if you get sick, you come and ask, can you give me this medicine? I want this, I have problem this. They will ask, you have obligation? Yeah. Now they start ask, but some other place in far rural, still not follow, but now in the town and they check, I don't have, so you have to check. Or now they want to do business, they have set up their doctor, one doctor inside there. So you can check with him only $2 and then get ordination and buy medicine there.
Okay, I think time is up. Let's give him a big hand for
Too long.
next presentation. And may I ask Sombat and Kim Yen as next two commentator.
So it's me.
Yep.